In this question, it's asking us about a patient's chart mentioning the abbreviation SOB, and the question is asking, what does this abbreviation commonly refer to in medical terminology? So it's important that you review your approved abbreviation terms, because we don't want to use an abbreviation in a chart if other people might not actually understand what that term is referring to. And we want to make sure that when we're reading a chart that we understand accurately which terms are meaning for this patient. So let's look at the choices to see which ones represent an approved abbreviation to use in a patient's chart. So we have our choices here. And it could help to see if there's any we can eliminate right away that do not have S, O, and B in the acronym. That's just an easy tool to eliminate some choices. So we see strep throat has S and T, so we might consider eliminating that possibly, but we'll look at the choices to the side. We see subcutaneous injection, SCI. That's not exactly SOB either, so I'll probably eliminate that maybe. Shortness of breath, SO and B, so that looks good. And then status asthmaticus is SA. So we have in the back of our mind that we probably will eliminate strep throat, subcutaneous injection, and status asthmaticus, because all of these do not have the abbreviation SO and B. They have other letters used. But let's discuss what all of these choices mean so we could best understand how to approach this question. So looking at strep throat doesn't typically have an acronym. Usually you would just state in the patient's chart that they tested positive or negative for strep throat, and that's not an acronym that SOB usually stands for, so we can eliminate option A. Looking at option B, subcutaneous injection, typically the only abbreviation you'll see for subcutaneous injection is sub-Q, because the Q here kind of sounds like the letter Q over there. So that wouldn't be SOB, so we could eliminate choice B as well. Option C says shortness of breath, S, O, and B. And yes, this is correct. SOB is an approved abbreviation for shortness of breath acronym, so we will go with option C, but let's look at choice D to be sure. And status asthmaticus, this typically does not have an abbreviation, and you wouldn't see SOB meaning status asthmaticus. That would be shortness of breath, not status asthmaticus. So we can eliminate choice D, and that leaves us with the correct choice of shortness of breath, SOB, for choice C.